Hello everyone, my name is Ardianti from Universitas Airlangga, Surabaya, Indonesia. Today I will present my 7th-week summary of MOOC Cleft and Delete. So I already received lecture of assessment of VPD from Dr. Karoon Agrawal, impact of CP on speech from Dr. Nana Akua Owusu, cleft speech therapy in the context of speech therapy from Prof Julius Ademokoya, management of newborns with clefts during COVID-19 from Prof Rouma, multidisciplinary team approach to cleft care from Prof Peter Donkor. Cleft craniofacial team is a means of organizing complex and multi-spatial care in humanistic and cost-effective manner. Though health payment mechanism, culture factor, and health system character have effect on multidiscipline craniofacial care, but gold standard for cleft care are team-based, helps to eliminate fragmentation and dehumanization. Team approach must reduce costs, minimize school and work time loss, promotes more comprehensive view of care. Assessment must be conducted by team consist of leader and from multidisciplinary field. CP is one of etiological factors of VPD. VPD effect on speech includes hypernasality, abnormal resonance, and compensatory articulation. While speech develops at 3 until 3.5 years of age, diagnostic instrumentation can be done at more than 5 years of age. Sample by using rigid Manso endoscope and video fluoroscopy. Infants born with CLP had different focal tract conditions. In babies with unrepaired cleft delete, they produce more folds and fewer range of consonant. They need SLT, speech-language therapy, and CST, cleft speech therapy. As speech therapists, they must understanding nature of speech disorder, identifying, retrain, and rehabilitating speech disease. CST require multidisciplinary service delivery. More comprehensive, the better service outcomes. Scope of CST professional practice like speech language therapies, orthodontics, prosthodontics, nursing, surgery, dentistry, pediatrician, and psychology. COVID-19 found out have effects also on children. Despite the pandemic of COVID-19, the parents still must receive the necessary information and psychological support they need, like prenatal diagnosis consultation and newborn consultation. Sample of treatment sequence. From treatment, we can start by surgical repair of cleft lip, 6 months, first speech evaluation, 9 until 12 months, repair of cleft lip and placement of ventricle tubes. 1 until 7 years, orthodontic and speech therapy. 7 until 9 years, alveolar bone graft. More than 8 years, continue the orthodontic treatment, and more than 18 years, we can do orthodontic surgery. So that's all my resume for 7th week of MOOC CLP. Thank you for your attention. Stay healthy.